In this class, we're going to tackle very simple, very straightforward things that you can do when you're healing or reconnecting with your postpartum core. Maybe postnatal is 8 weeks out, maybe it's 8 years out. It really doesn't matter. I've worked with people at any stage of after having kids, and all of us need a little help reintegrating post-pregnancy because it changes the entire pressure volume system of the abdomen between the diaphragm, the abdominals, the lower back, the pelvic floor. All of that is shifted a little bit, including your organs. So first things first is be patient. Second thing is it's okay if you can't go back to everything that you did before. And I want you to know that you might be able to go back to a certain level of that, or you might also find that you don't like what you used to do. So this is just maintenance for that. It's reconnecting and maintenance for that. So I do have a few props that I'm using. The first thing I'm going to have is some head support, because it's going to be really important for us to explore getting your ribs down onto the mat without your shoulders rounding or your head and neck pulling. The second thing is I have a stack of yoga blocks, but I also have a magic circle. You don't have to go out and buy a magic circle to do this, and you don't even have to have yoga blocks. You could just have sofa cushions, a pillow from your bed, several pillows. At some point we are going to pad up several layers. You know, sometimes I will do that, like I have a poof in my living room and I'll just use that. So let's get started. Resting on your back. So I would say, especially if we've got diastasis, if you're still feeling any things at your, like if you have a C-section scar, I would say lay on your side, then roll over onto your back. I'm making sure that I have a yoga block within my reach for later, and I'm just going to adjust my head support. Now, as you rest on your back, you might feel like you automatically tuck your butt under, or automatically your shoulders roll, or your ribs are off. You know, something in the, you want something that feels like my head, my rib cage, and my butt can find the mat. So I'm looking for my sacrum and pelvis, my rib cage, and my head to find the floor. Now, if the floor and my body and my posture is such that maybe I can't do all of those things, I might pad my head up a little higher so then my ribs can drop without it pulling on my neck and shoulders. Or I might sacrifice a little bit at my pelvis and just let my pelvis tilt just a little bit towards my face, because that's exactly what we're going to explore first. Breathing and moving your pelvis, right? So take your hands maybe to kind of the lower abdomen. You'll feel these hip bones right here called your ASIS. They're sort of sticking out. And then I take my fingertips kind of across my low belly and in the direction of my pubic bone. And you're going to breathe in, filling up your hands, letting your ribs move. As you exhale, draw your belly away from your hands, and you're going to think about gathering those lower abdominals in and up, similar with your pelvic floor, gathering in and up like a little elevator inside of you, and use that in and up energy to curl your pelvis towards the direction of your face. So we're doing what's called a posterior tilt of your pelvis. You will feel that your back got a little heavier, a little more contact on the mat. When you inhale, you are going to release back to where you started, and you can even go forward, letting your pubic bone be lower than your hip bones, and your back will lift away from the mat. So anterior tilt. So we're going to breathe in here. Exhale, pelvis tilts towards your face. Exhale, exhale, exhale. Making sure the belly doesn't squish up towards the ceiling. It should be dropping back as you exhale. Inhale, rolling the other way. Maybe just bringing it back to where you started is good, or if you want to go a little farther and lift the back up, that's fine. Exhale towards your face. Letting the belly draw in, back, and up. Inhale, releasing forward. Now, as you continue to do this, you are going to start to tune into what is the pressure like in your tail, your sacrum, and the two sides of your pelvis, or your two butt cheeks, basically. So what does that pressure feel like as you roll towards your face and then as you roll the pelvis and your spine towards your feet? Does it feel even? Does it feel totally crooked? Does it feel that one side can really move a lot and the other side's a little stuck? And what you would love to do over time and through using your breath and your belly connection is to coax that into a little bit more even pacing. So I'm looking for the rhythm, right to left and up and down, to be even. Exhaling towards your face, inhaling towards your feet. We're going to do one more like that. This is something that you can do pretty early postnatal, so like pretty early you can just start breathing and doing this. You can even do it seated. I would just do breath work seated while I was pumping, just to give me something to do while I was pumping. And then you could add this movement of the pelvis seated. Now I want you to find a place, again, where you're like, can I get those ribs, head, and pelvis grounded-ish? The main thing is to make sure that your head is not being strained, your head and neck and shoulders aren't being strained to get your ribs down. So I want to see if I can get my front ribs. So I'm going to take my hands to my rib cage. I'm going to breathe in. And as I exhale, I'm just going to think, can I gently pull my hands towards the center with my abdominals? So I'm trying to pull my hands to center. I'm not trying to bear down in my belly and push it up towards the ceiling. I'm not trying to tuck my butt. I'm just trying to snuggle that together just a little bit in the front so that the back ribs can have a little bit more weight and width. Then you're going to reach your arms up to the ceiling, maybe wiggle your shoulder blades, especially if you're nursing. Even if you're not nursing and you're bottle feeding and you're carrying a baby around, so much shoulder and neck tension. So let that be comfortable here. My shoulder blades are grounded and I'm trying to coax my ribs down. Now, as we are starting to build back up this awareness, you might have to tilt the pelvis a teeny bit towards your face to allow the ribs to drop down fully. And maybe you explore that. And then over time, you let the pelvis go to a more neutral position. But go where you need to go to get those ribs down. And then what you're going to do is with the palms facing each other and the elbows straight, you are going to exhale, have a little hug of your belly down, a hug of those ribs together and down, belly dropping back towards the mat as you reach your arms overhead. So exhale there. Inhale, bring the arms back to the ceiling. I'm specifically not letting my arms just go elbows wide, arms to the floor, right? I'm really keeping the container pretty narrow and tight for my arms, and I'm going to exhale as I reach the arms, keeping my ribs grounded as I exhale. When I can exhale no longer, I'm going to inhale and bring my arms to the ceiling. One more in this breath pattern as you exhale, belly, ribs dropping down. Inhaling as you come back up. Exhale and hold there. Now you're going to inhale and reach the arms. So you're going to inhale, allow your ribs to be like gills on a fish. You're going to breathe into the sides. You're going to let your ribs move with your arms, but not away from the mat. So you're not arching so that you don't strain the anterior line here of your abdomen. You're going to breathe into that back and side body and exhale, bring the arms back to the ceiling. We're going to inhale and reach again. I'm letting my shoulder blades move. Check in with your throat and your neck. Try and let that have minimal tension. So now we just reverse the breath pattern, and everyone has a preference, so pick your favorite. Inhale, reach. Exhale to the ceiling. All right, from there, just bring your hands, one to the top of your belly, one to your lower belly, and breathe in. And as you exhale, could you think about drawing your hands a little together and a little bit back towards the mat? Just enough, right? Not enough that you overly strain anything, but just enough that you feel like, oh, okay, can I feel a little tension in the abdominal wall, right? Do that 2 more times. Just breathing in, breathing in, breathing in. And then exhale, sort of feeling that drop of the front of the ribs, a drop of the belly back, feeling a little maybe that connection of those lower abs that we started with. And one more. Exhale, exhale, exhale. Slide your head support away. Keep that tension in this anterior line, not bulging tension, just enough to feel like, okay, my ribs and my pelvis, my breastbone, my pubic bone have some tension there. You're gonna have your feet hips to shoulders width, arms are down by your side. You're gonna press into your feet. You're gonna lift your hips up, opening up the front of the hips and working the back of the hip. Now, a lot of times we bulge our belly and we arch our back. So I just want to think, can you articulate this movement from your hip joint? No pressure in your neck. You've got weight in your feet and weight in your upper back. And then you're just gonna drop the hips down. You could roll down or you could just hinge and tap the butt down. Totally up to you. You're going to come up again for 2, and then we're gonna come down. 3 and 4, just bridging to wake up our hamstrings and our glutes. Just enough belly tension that you can find, right? It's sometimes hard to find it when we're just starting out. So if you have only had a brief amount of time since a baby came out of you, then, you know, just be patient with yourself and maybe you go smaller. If you've had more time, you might feel like, oh, I can feel my abdominals for sure, but they don't feel as strong as I might like them to be. Then you're gonna come down and you're gonna bring your feet to touch, squeezing the inner ankles, the knees, and even thinking about my outer hips hugging in. Now, if it's really a strain, either on your quadricep around your knee to do this, or just to get your legs this close, you take a block, you put it between your thighs on the narrow setting. Don't have a block, use a pillow. So put a pillow between your legs. So any of those are great options, and you're gonna be really narrow. So this range of motion as you press into your feet, this is a smaller range of motion because now we're limiting how much hip extension you can get. Still a little bit of belly, but a lot of hip work in the feet to butt connection. And we're gonna do 10 here. So you've got 1, 2, 3, 4, 5, 6, 7, breathing, 8, 9, 10. Come all the way down, and then go ahead and turn your feet out with your heels together and your toes apart and your knees apart. You still want to aim your knees over your middle toes as you squeeze the heels, press through the whole foot so you're not turned out so much that you can't get your whole foot down. It's not a ballet turnout, it's just a modest, like no more than shoulders width. As I bridge up, I'm sending my knees out over those middle toes, squeezing and pressing through my heels. Ribs are heavy, so my upper back has weight, not my neck, and I'm gonna see one side lifting higher than the other. Do I feel one side working more than the other? Try and find some balance. Sometimes level feels really uneven, so you might look and see, well, how do I get level? And you do 10 here. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Come all the way down. Bring your legs to parallel. Take your pillow between your legs, your yoga block between your legs, whatever you're working with, right? If you do have a circle, you can do this with a circle, so that's fine. I just find the circle is sometimes a little bit wide when we're just starting out. It just sometimes feels like too wide, especially at the pubic bone if you had a vaginal birth. Then we're gonna take our hands behind our head and neck, and I'm really gonna take my thumbs and support and traction my neck, and my hands are really supporting my skull. And then we're gonna wrap the elbows a little bit towards the ceiling so I can see them in my peripheral vision. And we are gonna exhale and lift up just a little bit. Now, I'm not lifting up high. This is like a few inches, just enough so I can take my eyes and gaze down the front of my body and notice, did I come up so high that I'm bulging my diastasis, my rectus abdominis basically. So breastbone to pubic bone is that rectus abdominis. We oftentimes get that split somewhere in the middle. Some people get it lower, some people get higher. I've got it right in the middle around my navel. And so we're gonna see, how high can I come up without poofing, basically doming is what they call it, doming in the center here. And I'm gonna think, am I keeping my head and neck connected? I'm gonna squeeze whatever's between my legs, to help my inner thigh pelvic floor connection engage, so that I engage inner thigh, pelvic floor, and belly all together as I exhale. Inhale, coming back. So very subtle, very small. Exhale, inner thigh, pelvic floor, hips, then the abs. Trying to think, can those ribs in my breastbone draw to my pubic bone without pushing everything up towards the ceiling? Very small. Exhale, hug everything to the center and roll through those ribs. Let your head be really heavy in your hands. Make sure that your shoulder blades aren't just propping yourself on the mat and you're not just like stretching your neck. I mean, that feels kind of nice to just stretch my neck, but I really want to have that little string lifting my elbows up, because that picks my shoulder blades up onto my ribs. And when my shoulder blades onto my ribs, then I'm moving everything at once. It's a lot more load for the belly, but it's also where we want to be working, right? And it's, I mean, this is like 1 inch, 2 inches, 3 inch, maybe I can get, but maybe just 1 inch right now is enough. It's going back to that control of your pelvis and your rib cage, right? So that's where we are. We started with those pelvic tilts and the arm reaches, but the arm reaches were really about the rib cage, right? And the breath in the belly. And this is the same thing. One more. Exhale, curling. And maybe as you did that, your pelvis needed to tip. Make sure that even if you kept it neutral or you kept it tipped towards your face, that as long as you weren't flailing it back and forth and you weren't doming too much, you're fine. Right? So don't overthink it. Over time, you can level everything out. You're going to roll to your side, use your arms to prop all the way up to sitting, and this is where we're going to get into a kind of complicated, it's not complicated, but you just have to grab a bunch of stuff to get set up. You're going to be on your hands and knees. If you have a bunch of yoga blocks, or you have a bunch of pillows, or you have a physio ball, like a big ball, or like a poof, like me, like in my living room I have a poof, you can use any of those things for this. So what's going to happen is, on your hands and knees, you're going to stack yourself up. Now, I have very long arms, so I have to stack like a lot of things, and we're going to put whatever part of your belly feels like the most slack. So if you've got a diastasis, a little split, probably that area is where you want to support. So you want to figure out that support. What I'm going to do, this is my favorite one, is I like to take a block and I put my circle on it. So if you've got this set up, you can do this. And I'm going to put it right at my belly. And I want it to give me a little bit of feedback, but I want to make sure that if I pull my belly, not around, but just pull my belly away from it, that it's not going to fall. So maybe this cork block is a little bit too much for me. So I have to do a fair amount of padding because my arms are long. All right, so here I am, and we're going to breathe here. And I want to inhale, and I want to breathe, and I do want my belly to move into the circle or into whatever surface you're working on, but also I want it to breathe into the sides and back of my body, so I don't want to just collapse into my belly. Inhaling, and on your exhale, pull your belly away from whatever it's resting on, so we're supporting our belly. Pull it in and up without tucking, right? So I'm not tucking my butt, I'm not rounding too much. It might feel like I'm rounding some, but it's relatively straight, so to speak. And then you're going to inhale, let everything relax and stretch and breathe. And then exhale, pull your belly away. Can you gather a little pelvic floor elevator? Maybe you think hug the inner thighs towards each other, belly lifts all together, so you feel like, what does that feel like? And then one more like that. Inhale. This time, as you think exhale, maybe you think inner thighs hug together, pelvic floor in and up, belly in and up. Hold there and see if you can hold your inhale or hold that tension in your belly for a second. Even when you inhale, can you hold the tension in your belly? Exhale, maybe deepen that pelvic floor belly connection as you stretch one leg back. Maybe just back is enough. Maybe you feel that you can lift your leg too. As you do that, just hold. Did you kind of collapse or rotate? So the surface that you're resting on can give you a lot of information. And then you're just going to bring that leg in and inhale. Then we're going to get a little smoother with it. So you're going to exhale. Inner thigh, pelvic floor, belly, reach the leg back. If you're lifting it up, lift it up, but you don't want to collapse into your surface of under your belly as you do this. And then bring that leg in. Breathing in, exhale, inner thigh, pelvic floor, belly, reach the other leg back and up. Doesn't have to be high. Come bring that leg in, inhaling. Exhale, inner thigh, pelvic floor, belly, reach the leg back. If you're lifting it up, try lifting it up. Inhale as you come in. Exhale, leg back and up. See if you can hold there. Stretch that leg long. Reach the opposite arm out. Could you stay stable there? Can you keep that tension? Pubic bone to breastbone, especially at ones that are a little wobbly bit. Everyone's got a different place. And then bring that arm and leg in. So a little bird dog, which is basic core stability exercise. Breathe in. Exhale, a little inner thigh, pelvic floor elevator, belly lifting in and up. Stretch the leg back and up. See if you can hold steady. Lift the other hand. Maybe you reach that arm out. And go for length here, but really that support in the center over everything else. Even if you keep your foot down or your hand out, whatever you need to do. And then bring the limbs back in. Take a moment there and shift back, taking your circle to the side and taking the block to the side. We're gonna make your way to standing. So hands and knees, tuck your toes, walk your hands back. So we don't wanna load the pelvic floor or the abdominal wall too much too soon. So play with what you feel comfortable with. As you exhale, inner thigh, pelvic floor, belly, as you lift your knees off, and just walk your hands back or your feet forward. Get some weight into your feet. Take a breath there. Dig into those heels and bring your butt over your feet first. So I'm not just trying to sit up or stand up. I'm trying to get my hips over my feet as I come upright. Then my ribs, then my shoulders. So last but not least, because our lives are spent here, squatting, standing, things like that, we're gonna practice just finding this when we're standing as well. So your arms are gonna reach overhead. If it feels tight in your shoulders, make sure your arm is a little bit forward, or just reach your arms to the side. But we're gonna bring the arms overhead, pretty narrow V, and you're gonna breathe in, and you're gonna exhale, and you're gonna see, can I exhale? Think pelvic floor elevator, belly pulling in. So I'm thinking both front and back, so everything's going in and up as I bring that leg up. Inhale down. Exhale. You can make sound to help you find that deep, deep core. So you can imagine you're fogging a mirror with your breath. Arms are up, you inhale. You exhale, exhale, exhale. I'm trying not to lean back. So that tension, ribs to pelvis, breastbone to pubic bone. Inhale down. Exhale, start with the belly, then slowly lift the leg the whole time you're exhaling. So you're pacing the exhale, challenging your balance a little bit. So then your glutes have to work a little different. Inhale, exhale, pelvic floor, belly, exhale, exhale, exhale. Inhale down, last one. Exhale, exhale, exhale. And then bringing that down. Bring your arms down where they feel comfortable. Do a little shoulder roll. And then that's it, right? Very simple, very straightforward. Things that you could do every day, once a week, 3 times a week, every single day, doesn't matter. That will help you kind of restore this. You know, it's a lot of strain and things, not only the pregnancy, but also like carrying things. It all is very heavy and it's fatiguing. So this is a nice way to start to rebuild this whole structure from your rib cage to your hips or your pelvic floor, because it's a pressure volume system that is going to get out of whack when we're in weird positions. So we just have to find places to reset. So I hope this helps you. Press your reset button. And until next time, keep moving.